Welcome to the World Health Assembly here in Geneva. My name is Professor Bettina Borisch. I am the Executive Director of the World Federation of Public Health Associations, and I'm here with two personalities that shape the World Federation. On my right side, I have Professor Eugenio De Souza from Brazil, and on my left-hand side, I do have Emma Rawson-Te Patu from New Zealand. Welcome to you both. It is time for us to present a little bit the personalities that make the World Federation, and my pleasure to have you. Thank you for being here. So let me turn to you, Louis. You have been president for 2 years. Just yesterday, you stepped down. You are now immediate past president. But what was your view now, today, on the last 2 years?
The World Federation has done a great job since its beginning, more than 50 years ago. And then for the last 2 years, I think we made a small but very significant change. I mean the inclusion of our mission of two new very powerful words. We included peace, the promotion of peace, and also the sustainable development as two main parts of our general mission. Besides promoting health, preventing disease, promoting well-being, it's now our mission also to promote peace and sustainable development. These will be translated in different goals. We have 7 goals. And I think that was a major achievement from the last 2 years. And I've been happy to be coordinated this change with our working groups, our governing council, our advisory board, and all our members of the World Federation.
Thank you, Louis. It is another way of starting, Emma, when, as you did it yesterday, we had your tribe with us, giving you a beautiful inauguration ceremony. So your presidency will start now, and I'm curious to know how you see the 2 years ahead. What are your plans with the World Federation?
Thank you, Bettina. Yes, we did have a beautiful inauguration ceremony yesterday where we had our cultural practice from Aotearoa, New Zealand, to support the handover from Professor Eugenio to myself. And it was very special for us to be able to share that because it's an example of a different worldview and how well-being is looked at from where I come from in New Zealand as a Māori, as an Indigenous woman. So I think in answer to your question, one of the main things that I would like to see is more focus on Indigenous equity and health outcomes. And this is very important given that 400 million plus people on the planet are Indigenous and that we still suffer the greater burden of illness and disease. I think the World Federation is very well placed with its broad connections and significant players and relationships with organisations like the WHO to be able to advocate strongly for the health of Indigenous peoples as well as peace, and peace is a prerequisite for health and sustainable development in all things.
And you see that presidents come in and promote what the World Federation is doing. Now, everyone has experiences, special views, but we have our common global view to live together peacefully and mostly without diseases if possible. We are working with institutions, multilateral ones, and we are working locally. So my question would be to Louis, how do you see your work as a past president for the next 2 years between the local and the global?
Actually, the next 2 years we have a big challenge that's organizing the new World Congress on Public Health in 2026 in Cape Town. And that will permit us to combine the local, the regional, and the global. We have South Africa and the African continent as a different situation from South America, where I came from New Zealand and the Australia and the Asia and Europe. So I think our main challenge is to find what are common between among all of us. We are public health workers, and we have some very good principles that unite us. So how to be actable is the main challenge for the public health. How can every people in different parts of the world with access to the highest standards of health that are possible? So combining the local activities, the regional activities, and the global activities is central to achieving actable health for all.
Thank you, Louis. Thank you very much. I think that here we say there is this very important thing that we call solidarity, to be together and to try to get our differences a common goal, and to make our differences also validate the common goal. I turn to Emma. Emma, if you look at your input, what would you call the local that can be brought to the global scene?
Thank you, Bettina. When I think about local and I think about coming from New Zealand, I think about a different confidence in speaking about the issues that comes from a country like ours, which is a different set of circumstances in terms of it being able to control our public health environment. And that gives us a certain different way of being able to come out into the rest of the world and talk about what works in a country like ours, and have different kind of success, and being able to be supportive of countries that don't have the, what I would call, privilege of the set of circumstances that New Zealand does. And that still requires us to be humble as a public health community, but able to also share and lead as a very small nation that's been able to be very successful in a number of ways.
As you see, we go through presidents, but we move forward. We have common goals. We come from different places in the world. We meet in Geneva with World Health Assembly and 194 health ministers that come from around the world. And we try to promote our goals. And I see that from your work to your work, there is a direct line. Thank you so much to you both, Louis and Emma.